Hi everybody, I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. With the growing interest of whole body MRIs that are commercially available, like the Prenuvo scan, people think that the panacea of early cancer detection is upon us. But is it really? Well, the current medical literature demonstrates that whole body MRI screening in asymptomatic individuals is not cost effective when considering the high rates of false positive tests and resulting downstream interventions. The false positive rate of a whole body MRI scan for preventative health screening in asymptomatic individuals is substantial, with published estimates ranging from 8% to 42.5%, depending on the population and protocol used. In a systematic review and meta-analysis of whole body MRI in asymptomatic adults, the pooled proportion of false positive findings was reported as about 16%, with significant heterogeneity across studies. In addition, the most robust population-based cohort studies found that the disclosure of incidental findings from whole body MRIs led to a sustained increase in outpatient healthcare costs, primarily driven by additional imaging and specialist consultations. This cost increase was not offset by a substantial rise in the detection of clinically significant disease, such as finding more cancer, as the majority of these findings were benign or of uncertain significance, and only a small fraction resulted in actionable diagnosis. Systematic reviews and meta-analysis confirm that the modest cancer detection rate of only 1.57%, pretty darn low, for commercial whole body MRI services such as Prenuvo, which target asymptomatic individuals, the expected false positive rate is likely to be in the range of 8 to 16%, but may be higher in populations with genetic cancer risk. Now I want to talk to you about sensitivity in medical studies. So sensitivity is a measure of a test's, doing this slowly, diagnostics ability to correctly identify individuals who actually have the disease or condition. It is the proportion of true results among people with the disease, so true positives, while specificity is the test's ability to correctly identify individuals without disease, which is the true negative rate. So the sensitivity and specificity of a whole body MRI, such as Prenuvo, in asymptomatic adults are best characterized by a recent systematic review and cohort studies. The most robust meta-analysis in asymptomatic individuals reports sensitivity ranging from 64% to 100% and specificity from 92% to 98%, with the highest values observed in pediatric and high-risk populations and lower values in general adult screening cohorts. In large adult cohorts with cancer predisposition syndrome, sensitivity was 64% and specificity was 92%. The sensitivity of commercially available scans is totally unacceptable to be recommended as a general screening tool for asymptomatic adults. Also, the types of cancers that are typically missed by commercially available whole body MRI scans include breast cancer, colon cancer, thyroid cancer, small pulmonary nodules, so early lung cancer, prostate cancer, early stage pancreatic cancer, and certain blood malignancies. Expert consensus and narrative reviews highlight that despite technical feasibility, undirected whole body MRI screening in asymptomatic individuals is inadvisable due to low diagnostic yield and lack of evidence for cost effectiveness, especially when compared to established targeted screening modalities. So in summary, whole body MRI screening in asymptomatic individuals increase healthcare costs, and it has no demonstrated cost effectiveness in improvement in health outcomes in detecting early cancer. So now the question is, would I get one? And the answer is no. And with that, I hope you learned something today. Thank you so much for listening. For more information or guidance, you can go to my website at www.paladinmds.com and have a great day.